This is an Aspen Vista collar in-service training video for healthcare professionals. The information in this video is offered as a guideline on how to apply and check the fit of the Aspen Vista collar correctly. Collar application should be used in conjunction with the clinical specialist instructions and should only be applied by those who have received the appropriate level of training and are competent to do so. The statements expressed in this film are not intended to be a substitute for professional medical advice. To apply the collar in the upright position, follow these 6 simple steps. Preform by bending or rolling the collar ends in towards the centre of the collar. This will help ensure that the collar conforms to the patient's anatomy, making it more comfortable and providing adequate motion restriction. Inform the patient to sit up straight, keep their head still and in neutral alignment with their shoulders relaxed. While pulling the side panels apart, position the collar under the patient's chin in contact with the sternum, with the side panels up and over the trapezius muscles. The sternal notch should be visible within the access window. At this point in the fitting process, it's okay if the patient's chin is not touching the chin piece. Ensure that the patient's chin is centered on the chin piece and aligned with the sternal notch. Loosely attach back panel Velcro straps to white or grey areas to maintain front panel placement during sizing. Do not attach Velcro straps to the green area, since this may interfere with the height adjustment of the front panel. Pull the dial out and turn clockwise to raise the chin piece. When the chin piece is supporting the chin, release the height adjustment dial and it will self-lock. To confirm the dial is locked, twist the dial without pulling. It's important that the collar is properly sized to provide adequate motion restriction. Ensure there is not a gap between the patient's chin and the chin piece. Ensure that the dot is completely within the sizing indicator. To tighten, anchor your fingers in on the front of the collar and peel back the strap on each side. Tighten and reattach, or keeping your thumb hooked into the opening at the front, you can then tighten the Velcro one side at a time. Form each side panel around the patient's neck by pushing inward on the back edge, whilst pulling the Velcro strap out, then forwards to attach to the front panel. This will enable the collar to conform to the patient's neck shape. Please make sure that the sides do not get caught in the back panel windows and that the front and back panels overlap each other, as this can prevent a good fit from being achieved. Check to see that the back of the chin piece is not pressing inward onto the throat and that they can breathe and swallow comfortably. If it is pressing inwards, you may need to readjust the position of the collar by lifting and angling the back ends of the side panels up towards the ear. To complete the application of the collar, ensure that the back panel is kept central and tighten each side equally until a secure fit has been achieved enough to provide adequate motion restriction. On visual examination, the collar should be checked from a front view and a side view. The chin should be centered comfortably in the chin piece. Their nose and chin should be aligned vertically through the center of the collar at the front. The head should be in neutral alignment and not overextended. Sides of the back piece should overlap sides of the front piece. The Velcro strap should be aligned symmetrically so that each side is the same. Sternal notch is visible and both the front and back panels are central. Chin, dial and sternal notch are all in alignment. The large openings in the front piece and back piece should be centered over the neck. The chin should be flush with the end and the chin pad should sit under the chin, not sticking out. The collar should be flush with the skin. There should be no slack or gaps in the collar. To check this, push your finger down past the ear behind the mandible. Run your finger along the collar towards the chin, then underneath the sternal aspect of the collar. The sternal notch should be visible within the access window. Run your fingers along the back of the head, along the top of the collar, and then under the bottom section of the collar. With the patient in an upright position, preform the front panel of the collar and position it under the patient's chin. Position the back panel behind the patient and dial the height of the collar until the patient's chin compresses on the chin pad. Attach and tighten the Velcro on each side of the collar. Pivot each side of the collar off the trapezius to support the chin and achieve a proper fit. Check the airway is clear and that the patient can swallow. Check no plastic is touching the patient's skin and that no hair is in the collar, and ensure the collar is a snug fit. If you have any concerns regarding the fit of the collar, please escalate to your local specialist team for review and appropriate management.